Good morning, New York. How's everyone doing? We're here live on the shores of Lake Ontario on this cold Wednesday. So I came down here because I wanted to talk about a couple things. I might have to shut off the video here and there. There's a couple other people here. But I wanted to talk about the loss of Brian Thompson, United Healthcare CEO, who this morning in Manhattan, New York, was shot as he came out of his hotel in downtown Manhattan. And first I want to say that my condolences go out to everybody who worked with Brian at United Healthcare Group. I'm an agent for United Healthcare. They're a big company, a Fortune 500. I believe they're number 4 on the list. And when we get into it, when I talk about it, I want to tell you, that healthcare is an evil business. And we need to start talking about the real changes that we can make from taking healthcare from for-profit to a non-profit business. I'll be right back. Hey, okay, I'm back. So I got to my spot. A little bit cold out here, a little bit colder than I thought, but let's talk about healthcare because, again, the CEO, Brian Thompson, this morning was gunned down coming out of his hotel in downtown Manhattan. The whole New York isn't safe. That's a whole different issue. I continue to be an advocate that if you're born in New York and you're given a social security number, you should be given a gun, because our politicians just don't care. The idea that, first of all, just on the gun issue, you're not allowed to have guns in New York City. You're just not. You're not allowed to have a shotgun. You're not allowed to have a rifle. You're not allowed to have any of these things in New York. So the idea that someone was able to get down to know where this guy's location was, how he came out, and then, put enough lead in him to terminate his life is telling. And that's why I say that healthcare is an evil business, and I'm in an evil business, and I hate to say that. For example, the other day I had a lady she's 88 years old. Her husband died maybe a year ago, 2 years ago, but somewhere along the line, drug coverage was dropped, and she needs this drug that is going to save her life, and it's $1,700. And nobody talks about that. So she went to get it, and she didn't have $1,700, so they don't give it to you, which leads us back to another issue about the people who are on Medicare, who have Medicare and Medicaid. We call them special needs plans, and that'll be for a discussion later on in life. But she didn't have the $1,700, so her doctor had to go and find some foundation who coughed up the money so she could live. Let's just think about that for a minute. So she could live, all right? She had to go find a foundation to cough up $1,700 so she could live. And the reality of it to me is that this shit is made in a lab. Like, all you do is click the button and you make a few more fucking vials. Like, hello, this is the problem. And again, if we must keep talking about this non-profit bullshit, every healthcare company in the country, and the health insurance company in the United States, every DME, durable medical equipment manufacturer, every oxygen supply, every diabetes, they're all nonprofits. They're named in the essence of public health, right? And what they really do is they make billions of dollars. Some might even say trillions of dollars. And their CEOs and their upper management and everybody at the top gets a lot of money, and that's the way it works, sadly. But when it comes down to the need of the people at the bottom who really have a genuine need, it's like, go fuck yourself, go fill out an appeal, and maybe by the time we get to you, we're hoping you're dead, or that you're too alive, you're so barely alive that you don't have the ability to really need this drug anymore, so they don't have to pay for it. And so I'm not saying any of this is relevant to United Healthcare Group, but I just know as an agent for United Healthcare, as when you have a certain market capitalization, there's just going to be decisions that are made against humans. Let's just be honest. There's going to be decisions that are made against human beings. That's the way it is. That's what freaking capitalism is about. It's about rewarding those people who make money for you. Who gives a fuck if you need a fucking drug to live? Too bad for you. You didn't plan it for your next day. That's on you. Which is utterly bullshit in my view, because, you know, we live in this world where there's a lot of diseases. And then after COVID, government was shoving shit down your arm and giving people lottery tickets and millions of dollars to take a shot. So then how come when somebody really needs some fucking medicine, it's like, no. And that brings us back to the Medicaid and Medicare. Really, like, honestly, all those TV commercials you see on TV right now for get your free benefits, get your OTC card, get all that stuff, that's all for the group of people who already don't pay. I mean, you're basically putting out commercial TVs for a population that fundamentally is not your working population and probably isn't watching those TV commercials anyways. And so this comes back to the whole affordable care mandate with Obama. It was never affordable. I don't really know what the thing was supposed to do. I wish I could say it helped with pre-existing conditions. I wish I could say that it provided all these cost savings. But you could have enacted some legislation that dealt with those things individually. The Affordable Care Act with the penalties and just making everyone buy a freaking product was just, it's insane. And the idea of putting healthcare forward and trying to help people is a good idea, but I don't think the government should be the arbiter of that. I don't think the government should be the one putting that position forward. And I just think suddenly, sooner or later, we all have to talk about this. Diabetes drugs 40 years ago where the medicine was pig insulin. Pig insulin, yes, pig insulin. Did you hear me? Piggy, oink oink. Yeah, one of those guys. Pig insulin, all right? And the daily cost of that was 25 cents a day. You know, I know this because I don't know if my grandfather used pig insulin. I'm not saying that, but he used to have the vials in the refrigerator and the bag of the candy right next to it, right? And nobody ever went around complaining about it. And yet today, diabetes treatment is $400 to $800 a month on your co-payment. That's what you gotta pay. And so, you know, maybe the government should help people learn how to be healthy, right? You know, but when you don't want to label the food and, you know, this whole big idea that, you know, it's your body, it's your right, until it runs into the government's obstacles or what the government wants to push forward is just, you know, utterly bullshit. So again, my condolences out to United Healthcare Group, all the people who had to work with BrianThompson. It's just sad that a guy coming out at 50 years old in Midtown Manhattan is just opened up like a government hit or something, you know. And I'm not saying the government, it's not the government. The government and insurance companies are in bed, but, you know, when this all comes and said and is done, it's gonna be probably about somebody whose family member, love member was denied care because they didn't have the money. And I just think that is just something terrible that we still haven't dealt with in America. People die because they don't have the money for drugs, while another group of people who doesn't support really the system but gets all the free benefits, they get all the drugs they want for free while other people die. I'm Rob. I hope Brian's family, his kids, you know, his company, they'll take care of him. So I wouldn't be worried about rushing to no GoFundMe donation pages or that. The market capitalization, United Healthcare Group they're going to support that guy. So, but the family and the children, they're not going to recover from this kind of loss. So we need to talk about healthcare. I'm not sure Donald Trump's he's got other problems. I'm not really sure that's going to be the forefront of his policies or what he wants to do. But people in the United States of America need to stop dying because they ain't got no money for their drugs. I'm Rob. Have a good day for now. Bye.